Self-care video. It is important to understand the anatomy of the lymphatic system to ensure the effectiveness of a self-care program. The fluid from the lymphatic system drains into the right or left subclavian vein, which we call the terminus, which is positioned above the clavicle area. All of the fluid on your right side, including your arm, chest and down to the waist, enters the right subclavian vein, and the rest of the body drains into the left subclavian vein. In lymphatic drainage, we always work proximal to distal, which means as the fluid ends at the terminus, we will start there and move back through a series of lymph nodes to the problem. For example, if you have a swollen leg, you will work the terminus area, then cisterna chyli, then iliac nodes, inguinal nodes, and then start working the leg. It is very important we clear all areas that the fluid drains to before working the problem area. There are a few lymph node groups that you need to know the location of, which are as follows. Axilla, they are positioned in your armpit. Iliac, they are positioned above your pelvic bone. Inguinal, they are positioned at the crease and inside of your leg. Popliteal, they are positioned behind the knee. One other important part of the lymphatic system is the cisterna chyli, which is a reservoir for fluid to drain to before it moves up through the thoracic duct to the left subclavian vein. The cisterna chyli has a very important role as it is responsible for draining most of the fluid in the abdomen and legs. We are now going to take you through a full body sequence. The time spent on each sequence can vary depending on your condition, so this video is a guideline only. All sequences are performed directly on the skin, but for the purposes of this video, our model is clothed. You start by opening the terminus area. It is important that the sequence is completed at the beginning of any session. This can be done by either sweeping the therapy heads, or the therapy heads can be held stationary on the site. You then sweep down the neck and around the ears, as this creates a drain for any sinus issues, earache, or swollen neck glands. We will cover facial work at the end of this video. Ensure you remove any puffiness in the terminus area before moving on to your next sequence. To work the arm, breast or chest wall area, you first place a therapy head in the terminus on the side that you are going to work on, and place the other therapy head in the axilla area. Hold for 30 to 60 seconds. To work the breast area, you can leave one therapy head in the armpit by gently closing your arm over the therapy head and proceed to work the breast area. We use short, slow sweeps to ensure the machine can effectively stimulate the lymphatic system. There are lymph nodes on the side of the chest area, known as pectoral lymph nodes, as well as near your sternum, which are known as parasternal lymph nodes, so it is important to sweep these. You can work the affected breast area for 10 to 15 minutes. Please note it is important to complete both left and right sides, as it ensures if fluid transfers over to the opposite side, it can be removed. Remember, when you work your opposite side, place the therapy head on the terminus of the side that you are working. If you wish to work your arm, you still leave a therapy head stationary in the arm pit. And using a bolster to support the arm, start by sweeping the upper arm and then move on to sweeping the lower arm. There are lymph nodes positioned above the elbow, so it is important to focus on these for an effective drain. Remember to use slow, short sweeps. In abdominal work, it is important that we clear the cisterna chyli. You place a therapy head on the left subclavian vein and the other therapy head place just above the belly button. The cisterna chyli is slightly to the right near the liver. This therapy head can remain stationary if required, or alternatively you can start moving it around this area, including the liver and pancreas, which is on the left. The area of the cisterna chyli should feel soft and relaxed. Often this area can be hard and tender, so as it plays an important role in the drainage of lymph, it is important to spend extra time here. Now release the iliac nodes by leaving the therapy head on the cisterna chyli and placing a therapy head first on the right iliac nodes, which are just above the hip bone, for 20 to 30 seconds, and then on to the left iliac nodes. Then you move on to your large intestine by placing one therapy head above the pelvic bone on the left-hand side, while using the other therapy head to sweep the colon area. Firstly, we sweep down the descending colon. Then across the transverse colon, and then up the ascending colon, as shown. If you find the machine sticks or cannot move over an area, stop and leave the therapy head in that area for 10 seconds, and repeat the sweep to see if it moves more easily. Once you have worked the large intestine, you move on to the small intestine. This can be done as circular movements over the area, and again, if you experience the therapy head sticking or not moving freely again, place and hold. It is important to note that close to 70% of our immune system is based in the abdominal area. Therefore, spending time in this area will improve with your overall health. A nice finish to abdominal work is to place the therapy heads on the kidneys, which is done by placing them just under the rib cage area on your back. This technique can be done by either holding them in place, or alternatively you can have them placed on your kidney area while lying down on a soft surface. Leave in place for 5 minutes. Leg work can be somewhat difficult depending on the agility of someone. So if in the event these sequences cannot be done, you might like to consider someone else helping. Remember, before starting leg work, it was important that you first open the terminus, cisterna chyli, and iliac lymph nodes before starting the legs. Place one therapy head on the inguinal area while sweeping up the leg with the other therapy head. You can do this by bending the knee if it makes it easier to reach. Whilst the leg is bent, you can also do the back of the leg at the same time. To work the lower leg, this requires a therapy head on the popliteal nodes, which are positioned behind the knee as follows. Then proceed to sweep up the lower leg and around the ankle if required. You can use pillows or blankets to raise the leg if it makes it easier, and again you may need someone to assist. Alternatively, as another option, you can just place one therapy head in the inguinal area and one on the popliteal nodes whilst the leg is elevated. This technique will still encourage fluid movement. The back is particularly difficult to work in a self-care program. But if you open up all the major lymph node sites on the front of the body, this will encourage fluid from the back to drain. A face technique involves first repeating our initial sequence at the beginning by opening the terminus, neck and around the ears, as there are a number of important lymph nodes in this area. There is also a series of lymph nodes under the chin, which should be cleared before moving to the face. All areas of the face are safe to work, but the pulse rate frequency on your machine should be set at 5 or lower. The scalp can be included, and you can place the therapy heads under the occiput at the back of the neck, which is very good for headaches or neck pain. If you suffer from sinus problems, you can start at the sinus point beside the nose, and with one therapy head held stationary near the ear, use the other therapy head to sweep just under the cheekbone. Complete a neck sequence by sweeping down the neck and then a few sweeps in the terminus area.